Okay, what's the best medicine for high blood pressure? Jake, that is a loaded question because there are multiple medications. It depends on a variety of factors, but the most common groups of medications that Dr. Collier recommends, one, are angiotensin receptor blockers that block the response to a hormone that goes to your lungs called angiotensin. Angiotensin 1 goes to your lungs, is activated to angiotensin 2, which makes your blood pressure go up. So there are two ways to block that. There are ACE inhibitors, which block that conversion from angiotensin 1 to angiotensin 2. And then there's angiotensin receptor blockers. So the angiotensin 2, which is the active blood pressure driven, makes your blood pressure go up hormone, can't get to the receptors and cause that response because it's like taking a toothpick and breaking it off in a lock. You can't stick the key in there. When you can't stick the key in there, you can't open the door. So you can't stick the key in there and cause the blood pressure to go up. So angiotensin receptor blockers are primary therapy. They have no substantive or significant side effects because all they do is block the response to that hormone. If that hormone isn't there, they literally do nothing. That's why you can't make your blood pressure drop too low. It can't really do any negative problems. It works wonderfully and has no negative sexual side effects, particularly in male patients. It doesn't take the lead out of your pencil. It doesn't impact your erections negatively at all. So that's always one of the first choices that I make. There are about 15 different medications in that group, different name brands by different manufacturers. Then there's calcium channel blockers. The most popular one, the ones you've heard the most about, is amlodipine, number one most prescribed antihypertensive in the world. It is a vasodilator. A vasodilator, basically, think about the plumbing, the pipes in your home. You have a pipe that's a certain size, and let's look at it this way, certain size. What that does, a calcium channel blocker, makes the pipe get bigger. So you have a bigger pipe with the same amount of fluid, ergo less pressure. Because again, same amount of fluid of blood inside the blood vessels, the arteries that are now bigger, so less pressure. Now, the great benefit of that is that the mechanism of erection is one of blood flow. Blood flows into the penis. There's a gate that's kind of like the Panama Canal that closes and holds the blood into the penis until a man ejaculates. When the man ejaculates, the gates open, the blood comes out, you lose your erection. That happens 100% of the time. So when people say, oh, I can go all night, not after you have erection, that's what's supposed to happen. Now, you can recycle in as little as 10, 15 minutes in some people, it takes longer. But that is the natural response. You're supposed to lose the erection after orgasm. Now, you have a bigger pipe. That means more blood flow going into the penis. That means longer and harder erections. That is a side effect that nobody ever complains about. Nobody ever says, oh, Dr. Collier, that blood pressure medicine, it lowers my blood pressure, but it made my erections too long or too hard, so I don't want to take it anymore. No, they come in and say, my blood pressure is controlled, Dr. Collier. And guess what? My love life has changed a bit as well. So one of the reasons that those are my first two choices, but though there are multiple reasons that might not be appropriate for a person, or that it requires more than one drug. The average person literally requires 3 medications minimum to control blood pressure. And that is a good thing because you take lower doses of multiple medications. One pill comes from this way and pushes the blood pressure down. The other pill comes from this way and blood pressure down. But the combination of the two presses it down lower. So you get a better response from lower doses of multiple medications, which decreases the chance of having a negative side effect and improves the chance that you will have continuous control. If you take one drug and you keep pumping the dose up, eventually your body will acclimate to that, and it may work quite well today, but tomorrow or 6 months from now, that same dose of the medication might not work to control your blood pressure as well because your body will acclimate. So that's where we are with that. Great question, Jake.